Okay, that's the vagus nerve right there. Can you see that small nerve at the tip of the mosquito forceps? So that is a branch of the vagus. What branch is that? That is called the recurrent laryngeal nerve. That's the left recurrent laryngeal nerve. It will hook below the aortic arch. This one right here is the aortic arch. So the recurrent nerve, it will go back up to the neck, and it will innervate the muscles of the larynx. The more distal segment of the nerve, the segment that is close to the larynx, sometimes they are accidentally damaged or transected during neck surgery, especially thyroidectomy. So the consequence will be hoarseness or changes in voice, or worse, sometimes it can lead to airway obstruction due to paralysis of the vocal folds or the vocal cords. So that's the left recurrent laryngeal nerve again. We have recurrent laryngeal nerve also on the right side, but it will recur, or it will go up back into the neck at a more higher position. Unlike the left, which will hook below the aortic arch, the right recurrent laryngeal nerve will actually branch off from the vagus nerve and hooks below the brachial artery. So this one is the aortic arch once again. Then this is the left pulmonary artery. So this structure right here, this is called the ligamentum arteriosum. Ligamentum arteriosum. So it is a ligament that connects the pulmonary trunk and the pulmonary arteries to the aortic arch. Actually, that is our landmark for locating the left recurrent laryngeal nerve. The left recurrent laryngeal nerve is immediately on the left side of the ligamentum arteriosum. So what is the significance of the ligamentum arteriosum? So in adults, it is a ligament. It's non-functional. But in the fetal anatomy, in utero, inside the womb, the ligamentum arteriosum is actually a functional blood vessel, and it is called the ductus arteriosus. So what is the function of the ductus arteriosus? It shunts blood coming from the right ventricle, passing through the pulmonary arteries. So it will shunt the blood directly to the aortic arch, because in the fetus, blood that enters the right chambers of the heart are already oxygenated coming from the placenta. So no need to circulate going to the lungs. So it can be transported right away to the aortic arch and to the arterial side of the circulation.